All right, this is, I guess, a follow-up to the talk I gave a few months ago on where we were in healthcare reform. So where are we now? First of all, we won't, whatever happens, if something passes, we won't actually see anything significant for 4 years. There are a few things that happen. People who are in desperate straits may get some help through a high-risk pool, but other than that, there won't be anything for 4 years. And the core reason is that there are no savings in this plan. We've talked for years about the savings that are possible through single payer, and the fact that single payer basically pays for itself. You expand care and use the savings from simplification of administration to pay for it. There are no savings possible within the kind of expansion of private insurance that either congressional bill is proposing, and the result is that the Congress, operating under its budget rules, decided that it had to wait either 3 or 4 years to accumulate the money in order to start the plan. The way they put it is that they have to look over 10 years to see that the plan would pay for itself over 10 years, and it didn't, so maybe it will pay for itself over 6 or 7 years if they wait 3 or 4 years to start it. So it's a totally cynical exercise in where, as I think Donna said earlier, the actual health care was very little discussed, but the money and the budget implications are what was really discussed. Look, we are talking about healthcare reform today because of the rising costs, extraordinary rising costs over the last 10 years, more than the doubling of the cost of healthcare and of the premiums that we and our employers and Medicare have been paying. And these bills do nothing, absolutely nothing about that. I'll give you a few numbers at the end. In fact, instead, what the bills attempt to do is address the problem of the uninsured. The problem of the uninsured is surely a disgrace on this country that we leave millions of people with no insurance, but it is not a new crisis. It's been with us for decades, and in fact, the striking thing is, if I had the slides, I would show you that over the last 20 years, the percentage of the population that's been uninsured has been absolutely flat at 15%. So that is not new. What is new and has led both employers, individuals, politicians to raise healthcare reform to the level that it was this year is the rising cost, and yet the plan they're proposing in fact does nothing about it. It only addresses the problem of the uninsured, and because it does nothing about cost, my belief is, and I think it should be the basis of our moving forward in the way that Donna and Katie talked, is that the plan will in fact not solve any problems. It will not, in fact, in my view, seriously help very many people actually get care. What the experience in Massachusetts has been is that the number of uninsured is down, surely by perhaps 50%, but the people are not getting the care they need because the cost of care has gone up in the same time period, and the insurance they're buying is so inadequate. It's the kind of Swiss cheese insurance that we've talked about with high deductibles and high copays, and that's what's in store for the uninsured under these plans that are being proposed. There is, of course, a mandate, and you're going to hear a lot from the right wing about mandate, and I think we too believe you should not be forced to buy a commercial product that is a shoddy product. But the mandate is weak. The data basically the only data we have is from the Congressional Budget Office, and they say that the plans will cost people between 15 and 20% of the average person who buys insurance, between 15 and 20% of their income. The penalty is between 2 and 2.5%. So the estimates that the Congressional Budget Office is making, that 2/3 of the uninsured will buy insurance, seems to me way off mark. That with that kind, if you're talking about people whose incomes are only 2 or 3 times the level of poverty, that they're not going to spend 20% of their income for a completely inadequate form of insurance, a high deductible form of insurance, when the penalty is 1/10 of that. You'll hear a claim, and we've already heard a claim, a false claim, that 30 million people will be covered under this plan. How can we possibly oppose such a plan? Well, where does that number come from? The estimate is that 12 million people would get Medicaid, would be covered by Medicaid. Well, that I'll accept the use of the word covered there. They're covered by Medicaid. Where they can actually get care depends on finding physicians, additional physicians, who will take Medicaid. And because Medicaid itself is so inadequate, and in many, many states, including New York, doesn't pay, particularly in primary care, very well, those additional 25% or so of Medicaid recipients are going to have difficulty finding care. The other 18 million are not going to be covered. They're going to be buying insurance, according to the CBO. So they'll get insurance, maybe, if they buy it, but it will be completely inadequate insurance, and my own estimation is that far from 18 million people will buy it. In Massachusetts, by the way, there were very, very more substantial subsidies than we're talking about here. So what about costs? Well, the projection is that if the plan doesn't pass, costs will go up an average of 6.4%. That doesn't sound like a lot, but that's twice the rate of inflation. The general rate of inflation is 3% a year. 6.4% is a little more than twice the rate of inflation. Well, what will it go up with this plan? The estimate is it will go up by 6.0%. It will still go up twice the rate of inflation. By the time the plan goes into effect, healthcare will be at least 25% more expensive than it is now. Right. Just 4 years and 6%. You know, people are not gonna think the problem is solved. That's why I agree with Donna and with Katie that we're not going to wait another generation. We're going to be in a fight to get healthcare reform, and we're going to have support from around the country because the costs will continue, and the people who are not helped by this plan, those of us who have insurance through employers or through Medicare is, I won't talk much about the fact that you've all heard the fact that a substantial part of the financing of this plan is coming out of Medicare. So people who are Medicare are scared they won't have Medicare to rely on if this plan goes into effect. Those of us who are covered by employers will continue to be worried that the rising cost is going to lead employers, and absolutely it will, to cut back in the coverage that they're providing and put more of the cost, more of the burden on us, so that healthcare costs will continue to fall increasingly on patients. So the crisis that led to the debate this year, in my view, will continue, and will continue at least the pace that it was in the past, and the need for all of us to be active and we will find support from the public, because the public will see that nothing has changed and no problem is solved, and the need for a true plan that really does contain costs while providing care continues today.
Thank you.